If you tear at delivery, how do you come back from that? How can you heal? I know you sitting at home think this is absolutely miserable. That is not an area that needs to be affected by anything like this. And I am right there with you. But I'm also here to tell you that there are techniques and tools that you can use to help yourself heal, and it can get better. So I'm glad that you guys are here. Let's go through some techniques that you can use to heal.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
And yes, this video is just talking about healing, but I actually have a video on avoiding tearing that I'm going to link down below. It's going to be really helpful because if we can avoid it, then we don't have to heal from it, which I am a fan of. However, the majority of people have a first or second degree tear at delivery, and so these tools are super important for everyone. The first thing that you need to be aware of is your bathroom plans are going to change. How you take care of your bottom after you do those things is going to change. I actually have a whole video on taking care of your bottom after delivery where I go through the different things that you're going to use. Dermoplast, tucks, pads, ice, and how you're going to use that when you go to the bathroom. I think that's so important. So many people get overwhelmed when we walk them into the bathroom after they have their baby and we're showing them all of these different things that they're going to use. Be sure and watch that video because it's really helpful. And I got to say, in my prenatal class, which I took at a hospital, it did not prepare me for those at all. I actually have a class that I recommend that goes over how to prepare for postpartum. Super, super helpful. So many birth classes just leave that part off, but it's an important part to talk about. I'll link that class down below. That would have been really helpful to know that I had a whole rigmarole every time I went into the restroom. So make sure that you're using that time in the restroom. I know I would feel rushed because the baby would be crying or whatever, but you got to take care of yourself so you can take care of the baby. Make sure that you're concentrating on what you're doing in the bathroom to help you heal. It is super important. And there are some supplies that it's important to have at home. I actually have a whole postpartum checklist that I'm going to link to down below about the supplies you should be getting for you. It's so easy to concentrate just on baby, getting all the onesies and the diapers and the car seat, but there are a few things that it would be good if you had for you at home. The next thing you're going to be doing, which who knew that this was even going to be a deal, is to make sure that you're keeping your stools soft. If you are to get constipated, you're going to be pushing on that tender area, and we do not want to have that happen. Plus, if you've had a C-section, which would be different, but you also don't want to be pushing really hard with a C-section either. So every patient after they have a baby, taking a stool softener can be really important. I actually took Ducasate, which studies have shown is actually not very effective. Way to go. I actually recommend Senna or Senecot, so you can ask your nurse to switch you to that. I just think it's a whole lot better. Ducasate really never did anything for me. But make sure that you're taking that stool softener, into your healing journey until you feel like you really have things under control. The next thing is there is nothing going in that vagina. There's no tampons, there's no cups, there's no objects going up into the vagina. There's nothing that's going up in there. You don't want to hurt the rip, but you got to remember that in addition to tearing, your uterus has a dinner plate size scab after the placenta comes off. And so if you're introducing foreign bacteria through cups, tampons, other objects, that area can get infected because it's just right up in here into that giant scab. So that's one of the most important things to both help your uterus heal, but also your perineum from a tear or an episiotomy. By the way, if you're like, what's an episiotomy? Tell me more. I actually have a whole video on it. I'm going to link it down below as well. The next one is ice. I cannot tell you how important ice is. I think it's actually better than drugs. So I always recommend that everyone keep ice on for at least the first 24 hours and then keep it on when it feels comfortable. For me, it was hard to do an ice pack at home, so I kept my tucks in the fridge. So when I needed to pee, I would go grab the tucks in the fridge and then take them to the restroom with me. But whatever you can do to keep that area cold, it can really keep it much happier and less swollen. In the hospital, they should supply ice packs. A lot of hospitals do them in different ways, but if you're not feeling it cold down there, ask for a new one so that you're keeping that ice on the first 24 hours for sure. Now, here's a magical thing that not a lot of people talk about, and it is that area that has torn may start to itch after a while. So it's normal for our body as we're healing. If you got a cut on your hand or whatever, you will notice that it starts to itch after a while, just as those fibers are coming together. And this is just an area that you don't want to feel itchy in. So if you are, there is a spray called Dermoplast that they will likely give you in the hospital, but it can be really helpful, especially, when you're starting to get itchy. So Dermoplast can be used for that as well. If you're like, oh my gosh, what's going on? I'm so itchy. It's normal and it should go away in a couple days, but that's part of the healing process. Bodies are magical. But like I said at the beginning, learning to take care of your bottom after you have their baby is so important. I actually have that whole video about it. I'm going to link it up above and down below. Thanks for joining us here at the Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth and life postpartum.